Next, I will be discussing the nursing plan of care as it relates to tetralogy of Fallot. The nursing diagnosis that is most commonly found in these patients is decreased cardiac output related to ventricular septal defect, pulmonary valve stenosis, overriding aorta, and hypertrophy of the right ventricle. The decreased cardiac output is evidenced by fatigue, activity intolerance, dyspnea, cyanosis, knee to chest position, murmur, fainting, and irritability. The first goal for this patient would be to have the child demonstrate satisfactory cardiac output as evidenced by an improved activity intolerance and a decrease in fatigue and irritability. Interventions that should be done to enable the patient to reach this goal would be to provide adequate rest periods, especially between activities that require a lot of energy. Another intervention would be to monitor blood pressure, pulse, and oxygen saturation so that we can be alert and aware of any patient changes in cardiac output. Lastly, during acute phases, make sure the patient is either on bed rest or maintaining their activity at a minimum so that cardiac output isn't compromised. Another goal for this patient would be to have a decrease in symptoms of dyspnea and cyanosis. Interventions for this goal include monitoring patients' degree of symptoms and presence of symptoms, monitoring pulse ox and administering supplemental oxygenation per MD order, and placing the client in high Fallot's with legs down to decrease the workload and breathing.